Happy Monday to everyone. This is John McEntyre Show live. I could say John McEntyre Show live prime time, right? 'Cause we're almost in prime time. This is the evening. I'm John McEntyre. And so today is July 1st, 2024. And today is a very special day for a number of reasons. Beginning first day of the second half of the year. And today is also National Ice Cream Day. People that know me know that I'm seriously into my ice cream. Uh, Outside of school pizza, things like that, ice cream is up there, high up in my dietary consumption. So much so that I have to put it in the budget. We have to budget for it. So yeah, today is National Ice Cream Day, first day of the month. Normally, I start off with uh, wallet wins. But with this being the first of the month, I have to do the budget reminder for each month because each month presents itself with different budgeting needs that a lot of people as we work with clients, their budget sort of changes each month because of what's going on during that time of the year or whatever. And so with this being summer, this is definitely, as I've said in earlier shows, this is when utility bills go up, things like that. And so I just want to do some quick budget reminders before I actually get into the question, which is about Medicare and health savings accounts. So with this being July 1st, um, 4th of July is a few days away. The 4th, Independence Day, we celebrate in America. That's one of our huge holiday celebrations. And so it can be a lot of money can be spent on that day. Um, you could easily bust a budget on Independence Day. You have the 4th of July party. I love a good 4th of July party. Um, the more food, the merrier. A lot of travel happens during the 4th of July. So we have like gas price, a lot of fuel consumption. Um, Even though some people are saying the economy is this, that, and the other, spending is up this year. Definitely up in travel. Um, Airports are booked solid. Um, the hotels, Airbnbs, resorts, beaches are full. So people are spending money. They're spending a lot of money, and that fuel cost is a high one, and especially 4th of July. So now I digress back into the actual party part. So you spend a lot of money with the party. The McIntyre family for years and years and years, ever since I've been cognizant of celebrating the 4th of July. It started early in the day, around noon. We started with the barbecue and all of the good food, the grilling, the grills are jumping. We're having a good time, everything. And it goes till 11 midnight, something like that. The fireworks come out because we're all together and we're waiting for it to get dark. And we have our own fireworks shows. And so fireworks, they're not cheap. Uh, and in my family and some of the friends that I know, they go all out with the fireworks. I mean, they spend a ton of money for the fireworks, and so that's one to really think about budgeting for, and just summer fun. This is summer, so you constantly there's always something to do in summer. There's always something to do, but in the summertime, outdoors. This is the outdoors people. This is their time, one of their big times of the year where they're constantly. I know here in the Charlotte area we have the Whitewater Center, and I mean there's a line to the highway, and so people are, and it's fun. I mean it's not. I mean I love fun, so if you're budgeting for it, it's good. You don't have your fun and then wonder the rest of the month. Oh my gosh, how am I going to do this? How am I going to do that? So if it's put in the budget, you can have all the summer fun. I did mention the higher utility bills. Um, Air conditioning is always running. Here for the past few days, we've had 80 plus degree nights. And so, yeah, Air conditioners are running pretty much all night. Uh, People are still taking their vacations. Vacations actually spike this time of the year. Beach, like I say, the beaches are full. 4th of July, they're at their capacity. They're full filled to capacity. Then one that a lot of people don't really think about is back to school. It's time to start thinking about back to school. Uh, you have clothes. The older they are, the more expensive those clothes are. Unless, we have our in our household, Bella here. She can find a deal. She can go online and find a deal. She can look like $1 million and spent maybe 150. So that's the beauty of online. So you can really make your budget go a long way with school supplies and clothes. You take advantage of those tax-free weekends, things like that. Have those marked on your calendar. Have your budget so you can really make that dollar go far. Um, so you have your school supplies, have school clothes. Um, a lot of people that we work with and us ourselves, we like to support our schools, and so we have in the budget to buy extra supplies for the schools to support these schools, because the teachers, we're serious about supporting our teachers in the classroom, and so that's in the budget to actually not take just to take care of our child, but also to help with the classroom. Also, lunch. If the kid pay for lunch, they have the lunch account. You have the budget for the lunch account. I mean, I'm laughing about one of our biggest stories. Uh, we get the reminder, Bella's account is getting close to zero. They send out the reminder to let you know, whatever. I'm like, why is this girl spending so much money? What is she doing? Oh, and it was Bella, and there's also one of her cousins. They're like high rollers at school. They're like buying extra treats for themselves and for their friends. Oh, you want something? You want an extra, whatever. And so I'm like, hey, wait a minute. You're not putting in on this at the time. You're not putting in on this. You can't be out here being a high roller on our wallet. you know, this is our money. And it was so funny. It was the funniest thing. And, and that was our trigger to start teaching her about money. We started the little easy conversations about money that, we have to put money in the account and everything like that. But it was an eye opener. We have to actually remember to budget for that throughout the year, the lunch account and everything. And I'll talk about the other school stuff as once school gets started. But that's a big one, to plan for the back to school planning to put into the budget. So there we go. Some extra ones I posted on social media, some of those budget reminders for everyone to remember. So gotten that out of the way. Let's go into this question here. Um, and our question is actually shortened for on the graphic. So I'll read it out here the way I received it, part of it. My mom has been on Medicare for almost a year, and she remembered that she had an HSA, which is a health savings account, from her previous job. Can she use the HSA money for medical expenses without paying taxes on it? So basically, uh, goes what we've talked about before, to do a financial audit, a checkup to really look to see what you have. And this is the perfect example here of someone on Medicare, and from their working years, they had been contributing to a health savings account. And a health savings account is very beneficial because it's tax free. You contributed to it pre-tax, and it actually is inside of the account, and it actually grows depending on the company. It grows tax free, and you get to pretty much use it tax free for health purposes. This is a particular plan that has a higher deductible, um, health program, and so it's not to be confused with uh, what is it? We have flexible spending account, the flexible spending account, which is similar, um, but it's a little bit more restricted in the area, and we'll talk about that maybe that's for another time. But in this particular situation, this is the health savings account. You can use it pre-tax contribution, almost like a Roth IRA, not I mean like a traditional RIA, where you contribute pre-tax, it grows, and then you can use it for medical purposes, um, health purposes rather. Depends on the plan. Well, like I say, the short answer to this is yes. She can use it because it is her money. She made the contributions within some, and it's a few limits, not many, but it's a few, and it's a great plan um, for someone to actually think about as they get ready to go into retirement. This is a good strategy to use. Well, so what it can be used for, what your HSA can be used for in Medicare. Now you're on Medicare, you can contribute to it. Now, once you go on to it, once you go on Medicare, you can no longer contribute to the health savings account. It shuts off. You can't contribute. So that's why I say it's a pre-retirement strategy that could be used because you can't make any more contributions. But, and I'll make another point as I move forward. What it can be used for: Part B premiums, your Medicare Part B. It can be used for that because if you worked your 10 years, the Part A is being taken care of. You receive that free. So your Part B premiums and deductibles, you can use it. Your Part D, which is your prescription drug plan, you can pay your premiums with your health savings account. Your drug copays, your prescription drug copays, you can use it. So as you can already tell, this is a big benefit here. If the strategy is done right, you can really make this thing work. As far as Medicare plans, you can use the HSA to pay. If you got on a Medicare Advantage plan, you can pay premiums. You can pay copays with the health savings account. So that's a win for those out there on the Advantage plans. That's a serious win there. And miscellaneous, what they call miscellaneous, dental, vision, hearing, you can use your health savings account. So as you can tell, that's a big time win-win if you set this strategy up right before you go on to Medicare, make some contributions, you can use it. So I know that some people are and also the excess costs. You can use it in excess. Say, for instance, you're on an Advantage plan or whatever, and you go to the doctor. Sometimes they'll tack on an extra 15%. It's capped 15% excess is what they call it. It's quite common for it to happen. HSA will pay it. You can use your HSA to pay that. So yes, it's a big time win. Now, what you can't do, you can't use it on the Medicare supplement side. Pay premiums. You can't pay the premiums with the HSA. You can pay other copays, Medicare copays, and deductibles, things like that. If you have them, you can use it, but not on the actual supplemental plan. So if your plan is $150 a month, can't use the HSA. If you're on an Advantage plan and it happens to be $100 a month, you can use it. You can use it on Advantage, but not supplemental. Why? I don't know. Now, in this particular situation, it says that the mom had been on Medicare for almost a year before she remembered that she had an HSA. Okay, she has proof that she made all of the payments. She can pay back. She can reimburse herself. Basically, that's what she can do. She can reimburse herself. And so if you have an HSA, haven't been using it, you're on Medicare, you have your receipts and proof. You really don't have to have them. They know that that you're going to the doctor, and it's easy to get to prove that. Just in case an audit happened, it would just be that much easier just to have receipts. I mean, in your working years, you probably had to keep receipts and turn them in and everything like that. So just keep the habit up. Just set up a box or whatever. You have receipts, or if you have email, set up an email folder and send all of that to the email, and then you have them. And if they're ever needed, there you go. This is just for being organized. So there you go. That's the gist of it. Pretty much, you can use it for anything in Medicare other than supplement premiums, Medicare supplement, Medigap. Can't use it for Medigap. Use it for all that other stuff. Premium, deductibles, drug costs, dental, vision, hearing. You know, you're getting your exams, your eye exams, hearing exams. Might need a hearing aid or whatever. You could pay for it with an HSA, and that was tax-free money. It grew tax-free, and you're using it tax-free. That's a big time win, and that's for someone to really rethink their retirement strategy. If they're not haven't been contributing, it might be time to think about maxing it out, contributing the maximum amount that you can each year. And it also doesn't go away. Once you've contributed, it's there, it's waiting on you. Flexible spending accounts, for instance, I'll just say this: some of them, they may not roll over. HSA, it doesn't go away. It's your money. You contributed to it. There it is. Almost like an IRA account. You know, once you contributed it, the money just sits there. If you never use it, then you just never use it. It sits there waiting on it. So I hope that answered the question. I try to be as thorough as possible. It is now that should trigger you talking to someone about this, being more strategic with pre-retirement before you go and apply for Medicare and everything. You might want to maximize your HSA for post-retirement purposes. So there you go. Now, before I go, the question of the day rides off of that. Do you have an HSA or a flexible spending account plan, and are you using it? Because a lot of people, they have them and they don't use them. It's surprising. It is very surprising at how many people have these accounts, just have benefits, period, and they're not using them. They're not aware of them, or they've forgotten about them, or whatever. And that means it may be time to talk to a professional, sit down with someone like us. If we can sit down, ask questions, go through everything, do the financial audit, the checkup for you, and show you what you have, maybe remind you and maybe guide you on using it different ways to really benefit you. So that's the question. Do you have an HSA or FSA account? And if you do, are you using it? I will also post another question tomorrow. That's for tomorrow. It will be on social media. Everyone's telling me to wrap it up here. So have a good evening. We'll be back tomorrow. John McEntyre Live, prime time. I like that, John McEntyre prime time. Like there's something big, whatever. But I'll be back tomorrow, same time. Until tomorrow, this time, 7 p.m. Eastern Standard Time. We'll talk.